Hello, this is Dr. Gay from Foresick MRI, and this is a 69-year-old female who complains of anterior knee pain. And we have a couple of views here. This is a coronal view looking straight at the knee. We have the medial compartment. This is called the lateral compartment of the knee. And we have a third compartment, which is in the front, the patellofemoral compartment, or the anterior knee compartment. And she's having pain in the anterior compartment here. So we're going to focus on this. We're going to put up a couple of views here. One is with fat suppression. So on the right view, this is not fat suppressed. The fatty marrow is bright. Subcutaneous fat here in front and back, very bright. Muscle is dark. There's no fat in that. Now in this view, we did fat suppression. So all the normal fatty structures, the marrow and subcutaneous fat, are dark. And the things that stand out are inflammation and edema. So in the front here, we have a little bit of brightness, a little bit of edema in the front. And we're going to look for anything else. So on this view, we're going to concentrate on a couple things: the fat pads and also the patellar cartilage. So in the front of the knee, we have the kneecap or patella. It glides along in the front of this femur. The big bone here is the femur. Along the anterior surface, there's articular cartilage. It's called the trochlear articular surface. And the kneecap here glides along. And we can see that the kneecap has some problems. There's a few little tiny areas of irregularity right beneath the articular surface. Those are little tiny cortical erosions. Here and here, the cartilage is very thin. Normally we have a thick rind of gray cartilage across the surface. Instead, the cartilage is very thin, and we have little cortical erosions and a little bit of edema underneath. So this patient has some chondromalacia patella that is contributing to her anterior knee pain. This is an axial view. We see the kneecap here sitting right on top of the femur, which is right here. The kneecap is nicely aligned. There's no subluxation or abnormal subluxation or tilt of the kneecap. Looks good. But we can see here the little bit of brightness beneath the cortical bone. The cortex is a black line, and there's a little bit of brightness underneath. That's where we have the bone erosion, a little cortical erosion and subchondral marrow edema. And the cartilage, again, should be a thick gray band. Instead, we see a little bit of cartilage over here, and then very thin here, and then absent cartilage here. So again, chondromalacia patella with a little bit of marrow edema, but there's really no spurring of the patella, and there's no patellar subluxation. So we're going to keep on looking at this and find a couple more things. Number one, the second finding rather, is right here along the bottom of the kneecap. We have the kneecap here. Along the bottom, we have the patellar tendon that comes down here, attaches to the tibia. It looks nice down here, but at the attachment to the kneecap, we see brightness. This is a little bit of patellar tendinosis, irritation, micro tearing right there where it attaches. Along the edges, the medial and lateral sides, it's intact, but just centrally, there's a little bit of edema. And younger people who do jumping or play sports, you can get patellar tendinitis right here. We call it jumper's knee. And in this patient, she doesn't have any sports-related activities, so we just call it patellar tendinitis right here. This is the quadriceps tendon that comes down and attaches along the top, and it looks absolutely pristine. So two findings so far: chondromalacia patella and patellar tendinosis. And there's one other finding, and we're going to go over a quick anatomy of the fat pads of the anterior compartment. So there's three fat pads in the front of the knee. This is the femur, and right in front we have the prefemoral fat pad, this band here, bright fat, the prefemoral fat pad, appropriately named in front of the femur. And then in front of that, just above the kneecap, we have a little wedge here. This is another fat pad called the suprapatellar fat pad. And this should be really bright here, like the other fatty structures, but instead it's dark. So this is abnormal. It's a little bit plump too. Normally this is very small. This is a little bit enlarged and abnormal in signal on this. So we're going to look on this one that's really sensitive for inflammation, and we see that there is brightness up here. This should be fatty, like here or in the marrow, should be a dark wedge, but if there's a bright wedge, so we know that this fat pad is inflamed and swollen. So this is called fat pad impingement. She has abnormal mechanics, and this is getting pinched when she moves, and this is inflamed. So this is another reason why she's having her symptoms. The third fat pad, here's 1, 2, and the third one is down here. This is called Hoffa's fat pad. It's below the kneecap and above in front of the tibia here. And this is a big Hoffa's fat pad. Sometimes that can be inflamed as well, called Hoffasitis. But her Hoffa's fat pad looks great. Prepatellar fat pad looks great. And she has this inflamed, swollen suprapatellar fat pad. So 3 problems causing her anterior knee pain. Thank you very much.